So I'm here with Dr. Dennis Pick today. Dr. Pick, tell us your name, where you practice, a little bit about yourself.
Well, my name is Dr. Dennis Pick, and I'm a chiropractor. I've been in business since 1973. I started in Beverly Hills, doing numerous techniques. Started off with, probably 15 different techniques. I don't know if you want me to get into all that, but
Nah, you don't have to.
and then I moved to Westlake Village, which I've been here for the last 15 years. And I have two other practices. One is in Northern California, and the other one is in Bolivia, which I don't go every month, but I do go often enough. And so there's really three practices. And sometimes I go and I do there's a free service on Wednesday nights for the people who can't afford any kind of care.
That's great.
Um, and then I started NIS in 1994.
Okay. And so I'm curious about how's NIS changed your practice?
Well, the thing what I noticed with NIS is there's no guesswork whether or not you're doing the right thing or what you think is the right thing. It may not even be the right thing. So NIS has given me a little more freedom to feel confident that I know that the patient's getting exactly what they need, not what I think they should have. And that comes with a lot of certainty. And when you have certainty, you don't have to say anything if the patient already picks it up. So it's not an ego trip. It's just a certainty that the patient's brain knows more about anything that's going on with him than the doctor does. And that equals a lot of referrals and et cetera and results.
Dr. Pick, do you have a cash practice?
I originally did not in 1994. I switched maybe 5 years ago to cash.
And did you find NIS was helpful in making that transition from a insurance base to a cash practice?
Yes, because people who get NIS can't get it anywhere else. So it's not that I had a trip on that or anything like that. I basically raised my rates and said, if you want this care, you're going to have to pay for it. And it's not like a punishment. It's just like I was more comfortable doing it, and insurance companies would not pay for these extended visits. And so that's why I went up in price. And
yeah, and here's my view on that, Dennis, and that is that we're providing an incredible value to our patients with NIS, and you've obviously see that and have been able to get your patients to understand that as well, I think.
Right. There's nothing. I used to be a member of marketing companies and all that, and they would give me something like you have to see a patient like 3 times a week for 4 weeks, and that whole scenario there. But basically, that's on some type of a model that usually is predetermined by some guru who thinks they know more than their body knows how to get well, and I just had to get off that track.
Yeah.
And you know what? Patients pick it up when you're lying to them. It's not that you're really lying. It's just that you're blind. You don't know where you're going.
Yeah, that's so true. And I think you've already spoken to this, but tell us a little bit about what you're seeing clinically with patients, like with patient results with NIS.
Well, it's usually quite astounding. I don't even want to say it in that way, but it's rapid and astounding. And they don't need that many visits. I'll give you an example. I had a patient that had 17-year-old girl that had bone marrow failure. In the past, I wouldn't know what to do. Probably would have referred her out or something like that. But I was just doing a simple NIS protocol, and at that time I was just doing basic. I didn't do any advanced work, and I just found a bone marrow virus, and I did that procedure, and then she told her mom when she left the office, she said, I want to go run. And she's been locked in her house for months. And that was quite astounding. And about 3 visits later, she went back and got all her scans, and all the blood tests were normal.
That,
So
that, yeah, that's
that
a miracle, really.
that's a miracle. I've got a lot of miracles, but I'll give you another one. I had a patient that came to me for, well, she thought I was a chiropractor that just did musculoskeletal work, and she had back pain. So I did NIS. I don't remember what I did. And she came back a week later, and I said, how are you doing? She says, well, you don't know what you did. And I said, what did I do? And I was kind of like worried. She said, that time I saw you was my last hope, because I was going to go home and commit suicide.
Wow.
And see, so the beauty of this is I didn't know that she had that issue, but NIS picked it up and it cleared it. And that's the beauty of it. You don't have to know. And then I have a lot of people, for example, musculoskeletal issues that are floored when you just do a few, like when you correct the feet and all of a sudden their whole body stands up, or their gait and their legs loosen up and they even up, and that's not even a 5-second procedure.
Right.
So it's astounding work. And, I would recommend anybody who's looking to get better results in what they're doing to at least look into this.
Thank you. We've known each other a long time, and it's just fun to talk about NIS and the what we see on a daily basis with this. But I really appreciate you doing this, and because my belief is that more and more doctors need to know this work. So hopefully this will help get some more people interested.
They definitely should be interested, and at least take a taste of it. I think you offer something on the website where they can do like one protocol or something. Isn't that true?
I'm not sure what's available on that anymore, but
oh, okay.
Yeah.
Well, at least look into it, because once you read the website, there's no way you're going to not want to at least taste it.
Yeah. Well,
you just got to go to the website. It's all there.
Thank you so much.
And you're a great instructor, by the way. I've never had a clearer instructor than you are. So anybody who takes NIS from you is going to be gifted.
Well, thank you. And I appreciate your time today. We'll talk soon.
Okay. Bye-bye, Jim.
Thanks, Dennis.
You're welcome. Bye.